What is the difference between comminuted and non-comminuted fractures? Comminuted means that there's greater than or equal to 2 bone fragments that separate. So at least 2 bone fragments separate. What do compression fractures and depressed fractures have in common? Both are impaction fractures. Greenstick fracture affects the concave or convex side of the bone. The convex side. In what part of bone do torus fractures usually occur? The metaphysis. So a torus fracture is a buckling fracture. Name or describe a radiographic sign of an impaction fracture. A subtle radiopaque white line. What is the most common site of occult fracture? The carpal navicular, the scaphoid. Compare and contrast pathologic fracture and insufficiency fracture. Both of those fractures occur in diseased bones. However, sufficiency fracture implies that it's gradual or it's associated with stress. What are the synonyms for pseudofractures? Looser's lines, milkman's syndrome, increment fractures, and Umbauzonen. And in what condition do you get pseudofractures? Bone softening diseases such as Paget disease, rickets, osteomalacia, and fibrous dysplasia. What are the most common sites for diastasis to occur? The pubic symphysis, sutures of the skull, and the distal tibiofibular syndesmosis. What disease is associated with banana transverse pathological fractures? Paget disease. What diseases are associated with Salter-Harris 1 injuries? Scurvy, rickets, osteomyelitis, and hormone imbalance, often presenting as a slipped capital femoral epiphysis. What is the most common epiphyseal injury? Type 2 Salter-Harris. When is the earliest that osteoid can be seen on X-ray as a fracture heals? Osteoid can be seen after 14 days, so 2 weeks. What is a Volkmann's contracture? It's a compartment syndrome of the anterior forearm. It's a complication of fracture. What is the most common artery injured with knee dislocation, fracture of the proximal tibia, and or distal femur? The popliteal artery. What are radiographic signs of Clostridium perfringens infection as a complication of fracture? Thin, parallel streaks within muscle planes. What is the most common example of post-traumatic osteolysis? PTOC of the clavicle, traumatic osteolysis of the clavicle. What are the most common sites for non-union? Non-union, the mid-clavicle, ulna, and tibia. What tumor may arise after trauma? Aneurysmal bone cyst. Regarding skull injuries, what are the indications for CT instead of X-ray? Loss of consciousness, abnormal reflexes, sensory or motor changes, a palpable defect, discolored eardrum, vomiting, and amnesia. So neurological changes. What is the most reliable sign of a basal skull fracture? Air fluid hemorrhage level, or complete opacification of the sphenoid sinus. So air fluid levels, basal skull fracture. What is a radiologic sign of a leptomeningeal cyst? A widening of a fracture line within the skull. So that's called a growing fracture. What is the most common facial bone fracture? Tripod. How is a Jefferson fracture differentiated from pseudospread of the atlas? With Jefferson fracture, there will be greater than 3 millimeters of offset of the C1 lateral masses, and to pseudospread there will be less than or equal to 2 millimeters of offset, and it'll be a young age, less than 10 years old. What is the most common line of force in spinal injuries? Flexion. Give a radiographic sign of transverse ligament rupture associated with Jefferson fracture. An offset of greater than 8 millimeters of the lateral masses on the AP open mouth suggests that the transverse ligament is ruptured. What is the most common fracture of the atlas? Posterior arch fracture. Posterior. What is the mechanism of hangman's fracture? Hyperextension and rotary force. What is the most common site of teardrop fracture? Axis. C2. What is the most common odontoid process fracture and also the one most frequently leading to non-union? Type 2. Type 2. So there's type 1, 2, and 3. Type 1 is the tip of the odontoid, it's stable. Type 2 is the base of the odontoid, it's non-stable. And type 3, the fracture extends through the body, and it's also considered stable. How much tilt of the dens on AP open mouth indicates fracture? A lateral tilt of the dens greater than 5 degrees indicates underlying fracture. Which is more likely to occur after trauma? Transverse ligament rupture or odontoid process fracture? The fracture of the odontoid is more common than the transverse ligament rupture. If the dens is tilted posteriorly by 6 degrees, what does this indicate? On normal variant, the A to P tilt doesn't matter, it's the lateral tilt that you want to look out for. That lateral tilt's bad. Why is a vertebral wedge fracture considered stable? Because the intervertebral disc, ALL, and posterior ligaments are intact. What does an enlarged anterior tubercle of C1 indicate? A stress response secondary to chronic upper cervical instability. What are the radiographic criteria for a wedge fracture? If the anterior height of a vertebral body measures at least 3 millimeters less than the posterior height, a fracture of the vertebral body can be assumed. What neurological problems are associated with teardrop fracture in the cervical spine? Acute anterior cervical cord syndrome, consisting of complete motor paralysis and loss of the anterior column sensations of pain and temperature. Posterior columns are maintained. What is the most common form of pillar fracture? Compression type. Give a differential diagnosis for soft tissue emphysema following cervical spine whiplash. Tracheal laceration, pneumomediastinum, and pneumothorax. What does an arcual kyphosis in the cervical spine usually indicate? Muscle spasm. And what about the acute cervical kyphosis sign? Localized intersegmental posterior ligamentous damage. So an arcual kyphosis isn't as bad as an acute cervical kyphosis. What is the most common finding on post-whiplash radiographs? Loss of lordosis. What does the acute cervical kyphosis sign indicate? Also called the divergent spinous sign. It's localized intersegmental posterior ligament damage. How is a widened interspinous space identified? Greater than 2 millimeters of interspinous space compared to the other interspinous spaces. How much translation on a cervical flexion extension study is considered clinically significant intersegmental instability? Greater than 3.5 millimeters of intersegmental excursion identifies clinically significant intersegmental instability. What does this tetrad indicate? A wide facet joint greater than 2 millimeters, a wide interspinous space greater than 2 millimeters, a compression fracture, and a loss of cervical lordosis. That indicates significant tearing of the posterior ligament complex as well as instability. What is the main purpose of nuclear bone scan in the evaluation of a patient with whiplash? So nuclear bone scans can identify fracture. Why is MRI useful in evaluation of whiplash? Because only MRI can see cord edema. How soon after cervical spine whiplash may signs of degenerative disc disease be seen? As early as 3 months following injury. On axial CT, what does the naked facet sign indicate? Of both facets. It indicates a complete bilateral interfacetal dislocation. What does the bow tie sign indicate? Unilateral interfacetal dislocation or a jumped facet. What is the mechanism of injury of a jumped facet? Flexion and rotation gives the jumped facet. What plain film series is used to evaluate atlantoaxial dislocation? 15 degrees of lateral bending and 15 degrees of rotation. So you're actually putting your ear towards your shoulder. What is the mechanism of injury of a bilateral interfacetal dislocation? Hyperflexion. What are the most common sites of thoracic spine compression fracture? Between T11 and T12, those are the most common sites. What usually explains neurological deficits in a patient with a wedge compression fracture? Retropulsion of fragments into the spinal canal. A 60-year-old female has a compression fracture of L2. How would you determine if the fracture is stable? If greater than or equal to 2 out of 3 columns are disrupted, then it's unstable. So there's 3 columns, and if at least 2 of those columns are disrupted, it's unstable. So the columns are the anterior column from the ALL to the mid-body, the middle column from the mid-body to the PLL, and the posterior column is from the PLL to the supraspinous ligament. What does a step defect of the anterior body margin indicate? A compression fracture. How are traumatic and pathological compression fractures differentiated on plain film? With traumatic compression fractures, there will be a decrease in anterior body height, and a pathologic vertebral body fracture, there will be a decrease in anterior and posterior body height. There will also be pedicle destruction. Well, there could be pedicle destruction, and there could be a paraspinal mass. Not necessarily, though. What is the limit of normal variant anterior body wedging? 10 to 15% or 1 to 3 millimeters. So if there's greater than 3 millimeters or greater than 15% difference between the anterior and posterior vertebral body height, then you can suspect a fracture. What is the significance of a zone of impaction or a linear white band of condensation of a vertebral body? Those signs indicate a compression fracture within the last 2 months. What are the signs of abdominal ileus on plain film, and what is the relationship to spinal trauma? So there will be excessive amounts of small or large bowel gas in a distended lumen, and that results to disturbance of the visceral autonomic nerves or ganglia from pain. The majority of burst fractures are considered stable or unstable. They are considered stable. The majority of burst fractures are considered stable. A vertical fracture line is seen through the L4 vertebral body. What does this finding indicate? A burst fracture. That's the vertical line through the body. What is a posterior limbus bone? It's a separation of the vertebral body ring epiphysis. What is the most likely origin or etiology of the posterior limbus bone? It's most likely traumatic in origin, so it's not like you're born with it. Would you expect an acute hyperextension injury of the lumbar spine to fracture one pars at a vertebral level or both pars? So if it's an acute injury, it's just going to be unilateral, whereas the stress fracture will be bilateral. What is the mechanism of injury of pars interarticularis fracture? Violent hyperextension. Although, if it was a stress fracture, then it would take longer. So I should have said acute. The acute pars fracture is hyperextension. Is spondylolysis usually unilateral or bilateral? It's usually bilateral. So a type 2 spondylolisthesis, the isthmic, is also called spondylolysis. And that's a bilateral stress fracture. And that's associated with the collar sign you can see when the pars is fractured. What is the mechanism of injury of a chance or lap seat belt injury? Flexion and distraction over a fulcrum. In this case, the fulcrum is usually the seat belt. What is meant by empty vertebra? It's a fracture lucency of the vertebral body and the posterior elements associated with a chance fracture. Is a bone scan useful to differentiate old and new lumbar spine fractures? No. Both old and new fractures may be positive on the bone scan. What is the most common type and location of sacral fracture? A horizontal fracture near the lower end of the SI joints near S3 and S4. Where is a suicidal jumper's fracture typically located? It's a horizontal fracture of the upper sacrum affecting S1 or S2. What is another name for an iliac wing fracture? Duvernay. What is a Malgaigne fracture? Spelled with a G. It's a double injury to one hemipelvis, so it's two fractures on one side of the pelvis. What is the most common pelvic fracture? Malgaigne. What is the most common type of acetabular fracture, and what may be the only finding on plain film? Central acetabular fracture, also called explosion, and the only finding oftentimes is the obturator internus sign. What is the etiology of a rider's bone? It is avulsion fracture of the ischial tuberosity. What may complicate a straddle fracture? Bladder rupture and urethral tear. What is the maximum distance between the pubic bones? 8 millimeters in non-pregnant adults. 8 in non-pregnant adults, 10 in children. What is meant by sprung pelvis or open book pelvis? A complete separation of the pubic symphysis and one or both of the SI joints. What is the most frequent soft tissue complication of a pelvic fracture? Laceration or obstruction at the rectum. Which category of proximal femur fractures have a high incidence of a non-union and avascular necrosis? Intracapsular fractures. Most common type of femoral neck fracture? Subcapital. Subcapital is the most common femur neck fracture. Where do pathologic femur neck fractures most commonly occur? Basocervical. So, most femur neck fractures are subcapital, but the pathologic ones associated with underlying diseases are basocervical. List the intracapsular proximal femur fractures. Subcapital, mid-cervical, and basocervical. List the extracapsular fractures. Intertrochanteric, subtrochanteric, and trochanteric. What is the incidence of avascular necrosis as a complication to femur neck fractures? It's up to as high as 30%. What is the average time for radiographic signs of avascular necrosis to show up when it complicates a proximal femur fracture? So how soon can you see AVN on the film? 1 year on average. for that femur. What is the most common type of hip dislocation? 85%. Posterior hip dislocation. What is the most common complication of a posterior hip dislocation? Sciatic nerve paralysis. What fracture is associated with a posterior hip dislocation? A fracture of the posterior acetabulum. What is the most common location of pain in slipped capital femoral epiphysis? Thigh and knee pain. Regarding SCFE, which side femur is most commonly affected? The left hip. And males or females? Males are more commonly affected. What is the most common disorder of the adolescent hip? Slipped capital femoral epiphysis. Name the radiologic features of slipped capital femoral epiphysis. Decreased vertical epiphyseal height, wide irregular growth plate, frayed metaphyseal margin, beaked inferior medial epiphysis, increased teardrop distance, medial buttressing on the femur neck, lateral buttressing on the femur neck called Herdon's hump. Klein's line is abnormal. The metaphysis is lateral to the acetabulum, Kapiner's sign, and a curved contour of the deformed proximal femur called the pistil grip deformity. What radiographic views should be taken to evaluate for the SCFE, frog leg, and AP hip bilaterally? In subtle cases of SCFE, what may be the only detectable sign? Alteration in Klein's line. What is the most common complication of SCFE? Degenerative joint disease. What percent of patients with SCFE will have a bilateral occurrence? 20 to 30%. What is the mechanism of a fender fracture? Impact of femoral condyles being forced into the weaker tibial plateau. What percent of fender fractures occur from a vehicle-pedestrian collision? Not much, only 25%. What percent of patients with radiographic lipohemarthrosis have an associated fracture? Virtually 100%. What other structures are injured in a C-gond fracture, aside from the TFL insertion point? The anterior cruciate ligament, and also meniscal tears, and the lateral capsule. What nerve is often injured in a fracture of the proximal fibula? The common peroneal nerve. In a bipartite or tripartite patella, where are the extraossicles located? The superolateral pole. That's how you distinguish that from a fracture, because you're born with those things. Those are congenital. So superolateral will have those extraossicles. What is the most common type of patellar fracture? Transverse fracture through the waist of the patella. Describe the Danis-Weber A fracture. Type A consists of fractures of the fibula inferior to the tibio-talar joint and does not involve the syndesmosis. What about type B? Occurs at the joint level, and type C is above the tibio-talar joint. So ABC from bottom to top. Those are fibular fractures at the ankle. Describe Hawkins' sign. It is a linear subchondral radiolucency in the talar dome. It's a radiographic sign for an intact blood supply to the talus and represents unlikelihood of complicating avascular necrosis. In what types of ankle trauma must the proximal fibula be radiographed? In all instances of ankle trauma. Because of why? Because of the Maisonneuve fracture, which is a fracture of the proximal fibula that happens with an ankle injury. What is the mechanism of a Maisonneuve fracture? Forceful inversion and external rotation of the ankle. What bone is injured in a pot fracture? Pot with two T's. Distal fibula, proximal to the lateral malleolus. What are some clinical features of an anterior ankle dislocation? Depressions on either side of the Achilles tendon are obliterated. The talus is prominent anteriorly, and the dorsalis pedis pulse may be absent. When Bowler's angle is less than what degree is fracture probable? So the calcaneal fractures, if Bowler's angle is less than 28 degrees, it indicates depression and probable fracture. What degree of talar tilt indicates, talar tilt on an ankle stress radiograph indicates probable ligament damage? Greater than 10 degrees. Which talar fractures are more likely to be complicated by avascular necrosis? The more anterior the neck fracture of the talus, the greater the likelihood for developing avascular necrosis. What is the mechanism of the dancer's fracture? It's also called Jones fracture, and it's caused by an avulsive force exerted from the peroneus brevis tendon and the lateral cord of the plantar aponeurosis when the foot is forcefully inverted and plantar flexed. How is a Jones fracture differentiated from an apophyseal cleft? Jones fractures are transverse, whereas apophyseal clefts are longitudinal. What percent of bipartite sesamoid bones are bilateral? 85%. Which joints are involved in a Chopart dislocation? The talonavicular and calcaneocuboid joints. And what dislocates in a Lisfranc dislocation? The metatarsal bases. So Lisfranc is more distal, and Chopart is more proximal. What are the minimum views that should be taken with a foot injury? Dorsoplantar, medial oblique, and lateral projection. Which imaging modality is more sensitive at detecting rib fractures? Plain film or ultrasonography? Ultrasonography is more sensitive. What is another name for the tarsometatarsal fracture dislocation? It's also called Lisfranc. What may the costal hook sign indicate? A flail segment. Define flail chest. Two fractures involving the same rib, which isolates a section of the rib. What is for a pleural deflection? What is the name of the sign for a pleural deflection that is convex towards the lung? Extrapleural sign. What are the most common sites of fracture associated with coughing? The sixth to seventh anterior ribs. When lower ribs are found to be fractured, what tests must be performed? Intravenous pyelogram and CT scan. What is the most common birth fracture? The clavicle. What part of the clavicle is most often fractured? The middle. When a fracture of the lateral third of the clavicle is identified, what study should be done? Weight-bearing stress views. What neurovascular structure is most commonly injured with clavicle fractures? The subclavian artery. What are signs of non-union of the clavicle fracture? Sclerosis, rounding, and a smooth contour, also shortening of the fracture margins greater than 1.5 centimeters. What are the four categories of proximal humerus fractures in the NEAR classification, N-E-E-R? Anatomic neck, greater tuberosity, lesser tuberosity, and surgical neck. What is the most common site of proximal humerus fracture? The surgical neck. What nerve may be injured in a surgical neck of the humerus fracture? Axillary. What X-ray view best depicts a flap fracture of the humerus? External rotation. And what is a flap fracture? Fracture of the greater tuberosity, so you see it in external rotation. What does the Hill-Sachs or hatchet deformity defect indicate? Recurrent anterior shoulder dislocation. And what is the Hill-Sachs deformity? It's a compression of the head of the humerus. Describe the Bankart lesion. Avulsion of the inferior glenoid rim. And what's that associated with? That's also associated with anterior shoulder dislocation. So there's two well-known complications of anterior shoulder dislocation, the Bankart and the Hill-Sachs defect. So bilateral posterior dislocation of the shoulder is specific for what? Seizure-induced dislocation, bilateral posterior. Name other causes for posterior dislocation of the humerus. So electric shock, extreme trauma, epileptic convulsions, things that begin with E. What acromiohumeral distance indicates a rotator cuff tear? Less than 7 millimeters. Remember that deltoid pulls the humerus up, so the distance will shrink in a rotator cuff tear. What are the optimal radiographic views to evaluate AC joint separations? AP projection with 15 degrees cephalad tilt, and with and without 10 to 15 pounds of weight. What are the X-ray findings for a type 1 AC joint sprain? There is no findings. In type 2, a wide joint space, AC joint space, and slight clavicle elevation. In type 3, a wide joint space and severe clavicle elevation. What is the most common fracture to occur around the elbow in children? Supracondylar fractures. What is the most common fracture to occur around the elbow in adults? Radial head and neck. What is the name of the condition in which a small osteochondral fragment is sheared from the convex surface of the capitellum? A Kocher fracture, also called osteochondral fracture and osteochondritis dissecans. Which epicondyle is involved in the little leaguer's elbow? The medial epicondyle. What muscle may avulse the coronoid process? Brachialis muscle. Name 2 soft tissue signs of chisel fracture. Supinator fat line, fat pad sign. What are the most common fractures associated with a fat pad sign at the elbow? Radial head or neck fracture. What is the most reliable radiographic sign of intra-articular effusion in the elbow? The posterior fat pad sign when it's displaced. So a comminuted fracture of the radial head in combination with dislocation of the distal radio-ulnar joint is called what? Essex Lopresti. Comminuted fracture of the radial head and dislocated distal radio-ulnar joint. What percentage of forearm fractures involve both bones? 60%. What bone is affected by the nightstick fracture? Ulna, usually distal ulnar shaft. It's also called the Parry fracture. What is the most common type of elbow dislocation? Posterior and posterolateral of both radius and ulna simultaneously. What is the significance of the pronator quadratus fat line with regards to trauma? In almost all cases of distal radius fracture, the pronator quadratus fat line will be altered. What is the most common age and gender for Colles fracture and why? Female, greater than 65. Osteoporosis appears to be the underlying factor. What is the usual mechanism of Smith fracture? Hyperflexion of the wrist. And what is the usual mechanism of Colles fracture? A fall on an outstretched, extended hand. Compare and contrast Smith fracture, Barton fracture, and reverse Barton fracture. So which one is a fracture of the distal radius posterior rim? That's Barton. And a fracture of the distal radius, transverse fracture of the distal radius, that's Smith. With anterior angulation of the distal fragment, that is Smith. And a distal radius anterior rim fracture, that is reverse Barton. What is a torus fracture and what age group gets them? It's a buckled cortex after trauma, children between 6 and 10 years of age. Where does a chauffeur fracture occur? Radial styloid. What is a key radiographic sign for diagnosis of a torus fracture? Bulging of the cortex. What is said to be the childhood equivalent of a Colles fracture? A slipped radial epiphysis. What type of Salter-Harris classification is a slipped radial epiphysis? Almost always, it is a type 2 Salter-Harris. What is the most common carpal bone to fracture? Scaphoid. Which carpal bone is associated most often with occult fracture? Scaphoid. What is the fat stripe sign associated with scaphoid fracture? Navicular or scaphoid fat stripe. Which type of scaphoid fracture is more likely to result in complications such as avascular necrosis, non-union, and degenerative arthritis? The proximal pole of the scaphoid. What is the optimum radiographic projection to identify a scaphoid fracture? Ulnar flexion. Ulnar flexion. Describe the radiographic signs of avascular necrosis of the scaphoid following trauma. There will be increased density and fragmentation of the scaphoid. What percentage of scaphoid fractures result in avascular necrosis? Between 1 and 15%. Avascular necrosis is mainly seen with fractures proximal or distal to the main artery. Proximal to the artery. What is the most common instability of the wrist? Scapholunate dissociation or rotary subluxation of the scaphoid. How many blood supplies does the scaphoid have? 2. What are the radiographic signs of scapholunate dissociation? The Terry-Thomas sign, a wide scapholunate joint space, and the ring sign of the scaphoid that is rotated. What may result from overgrowth of Lister's tubercle? Atrophy and rupture of the extensor pollicis longus tendon. What is the usual mechanism of a fissure fracture? Hyperflexion and avulsion at the radiocarpal ligament. What is the most common carpal to dislocate? The lunate. Where are the 3 arcs of carpal alignment drawn? The midcarpal and radiocarpal joints, the articular margins of the midcarpal and radiocarpal joints. What disease is associated with lunate fracture? Kienbach disease or avascular necrosis. On a clenched fist PA wrist radiograph, ring sign and Terry-Thomas sign are noted. What is the diagnosis? Scapholunate dissociation, also called rotary scaphoid subluxation. What is the most common carpal displacement? Anterior lunate dislocation. Define perilunate dislocation. Dorsal displacement of all the carpal bones except for the lunate. Anterior dislocation of the lunate and a proximal fragment of the scaphoid is called what? De Quervain's fracture dislocation. What is the most commonly injured metacarpal? The fifth. In metacarpal neck fractures, which direction does the metacarpal head angulate? Anterior. What is the difference between Bennett's and Rolando's fractures? Rolando's fracture is a comminuted Bennett's fracture, and Bennett's fracture is at the base of the first metacarpal. A mallet or a baseball finger is caused by what fracture? A mallet or baseball finger is caused by a posterior chip fracture. What structure is damaged in gamekeeper's or skier's thumb? The ulnar collateral ligament. What is the modality of choice for detection of stress fractures? Bone scans. What are the earliest plain film findings for stress fracture? Periosteal callus formation at the fracture site. Give examples of conditions that cause fatigue fractures. Paget disease, osteoporosis, osteomalacia, rickets, osteopetrosis, and osteoporosis. Also, fibrous dysplasia, osteogenesis imperfecta. What syndrome is associated with stress fracture of the second and third metatarsals? Morton's syndrome. What is the most common site of stress fracture in the entire skeleton? Pars interarticularis of the lower lumbar spine at L4 and L5. What is the most common presentation of a sacral stress fracture? An elderly female secondary to osteoporosis with lower extremity paresthesias and sphincter dysfunction. What athletes most often get fibula fractures? Ballet dancers and runners. What is the most frequently seen and reliable X-ray sign of stress fracture? Periosteal and endosteal cortical thickening. How is osteoid osteoma distinguished from stress fracture? The oval radiolucent nidus of osteoid osteoma. How is osteosarcoma differentiated from stress fracture? Bone destruction will be seen with osteosarcoma. In infants between the age 1 month and 1 year, what is the leading cause of death? Non-accidental trauma. What are the radiologic signs of non-accidental trauma of childhood? Fractures in different stages of healing. Multiple closely approximated fractures. Metaphyseal corner fractures. Epiphyseal displacements. Exuberant periosteal new bone. What term describes a separation of the metaphysis in a circumferential manner? Bucket handle fracture. In non-accidental trauma of childhood, where are corner fractures most often seen? Metaphysis of the distal femur, and the bucket handle fractures that was also associated with non-accidental trauma of childhood. What are the most common sites of post-traumatic myositis ossificans? Brachialis, quadriceps femoris, adductors of the thigh, medial collateral ligament of the knee called Pellegrini-Stieta disease, and coricoclavicular ligament of the shoulder. What term describes post-traumatic myositis ossificans of the medial collateral ligament of the knee? Pellegrini-Stieta disease. In what muscle does Prussian disease occur? So it's a form of myositis ossificans in the adductor magnus muscle. What myositis ossificans syndrome may occur in paraplegics? Ossified lumbar bridge syndrome. What is the name of the following fracture? Fracture at the junction of the distal and middle third of the radial shaft and dislocation of the inferior radial-ulnar joint. Galeazzi fracture. A fracture of the radius within 35 millimeters of the joint and posterior angulation of the distal fragment. Colles fracture. Radial head comminuted fracture with distal radio-ulnar dislocation, Essex Lopresti, fracture of the proximal ulnar shaft with dislocation of the radial head, Monteggia fracture.